To- Today's topic is heavy metal intoxication and chelators, uh, and uh, many metals that are used in industry and in everyday life can be toxins as well because they bind to the proteins and inhibit functions. Most of them are enzymes, and that will lead to the heavy metal intoxication. Uh, the usual treatment is with the chelator drugs that bind to the uh, heavy metals and facilitate the elimination from the body. And one of the most common heavy metals for intoxication is lead, and lead poisoning is can be seen in in industry and in the everyday life, and still the the lead is the most widespread heavy metal, and is used in commercial purposes in the uh, batteries, for example the car batteries. All are the lead acid batteries, and also the metal alloys, including the jewelry, uh, soldering paste, and then also can be used for the production of the glass, uh, plastic, and ceramics. Uh, Lead can be contaminated through the tap water or through the air, food, and uh, uh, the main root of the lead intoxication has been a gas, but uh, in the last century, in the last years, uh, they removed the lead from the gas, so now it is not used as an additive to the gasoline, and that lead to the decrease in the contamination of the uh, products, and there are also increased measures to reduce the lead exposure at public places, and that lead to the decrease of the diseases that are connected with the lead uh, exposure. Uh, an inorganic lead is absorbed by the GI and also by the lungs, and fully absorbed through the skin. Most commonly, lead is absorbed through the lungs in the industry, and the uh, GI system is primary route for the non-industrial enter of the lead, and uh, absorption of the lead can increase if uh, with a uh, with a with low calcium and with low iron, and lead is mostly bound to erythrocytes and are distributed uh, in the bone marrow, brain, kidney, muscle, and almost everywhere, and also crosses the placenta and can uh, uh, intoxicate the fetus. Uh, the elimination is by the urine, and the uh, uh, the treatment of the lead intoxication is done with the termination of the exposure, supportive care, and inhalation therapy. Uh, the uh, the symptoms include cerebral edema, and this can be treated with uh, anti-inflammatory drugs like glucocorticosteroids and mannitol. For the seizures, the anticonvulsant can be used, mostly diazepam, and should also the urine flow should be maintained, and uh, intravenous added calcium disodium or calcium sodium EDTA can be administered for the chelation. Uh, then the next drug that is commonly can be seen in the nature is the arsenic, and arsenic is commercially and industrially used, uh, including as a pharmacologic agent to treat the syphilis, and mostly arsenic is used for the manufacture of semiconductors, as well as the alloys, glass, and insecticides, and also in the uh, drugs for the uh, animals. In some countries, water contains high levels of arsenic, and for example, in India and Bangladesh, it's very high, and it is toxic and can lead to the hemolysis. Uh, and the major uh, the major toxin that is produced during the production of the semiconductors is arsine, that is arsenicum H3, that is a gas, and uh, it's very toxic for the erythrocytes and leads to the hemolysis. And uh, uh, arsenic also is used, has been used as a drugs uh, as potassium arsenide, and it is the first antimicrobial agent that has been used for many centuries, many years, and uh, but nowadays it is replaced by the sulfonamides and uh, mm, modern antibiotics. And also some of the arsenic uh, arsenic substances are used as warfare agents, including arsine and uh, uh, some of the organic uh, organic arsenides are used for the treatment of the diseases, infectious diseases, including the trypanosomiasis, uh, but are not very common in all the countries. Uh, Arsenic is absorbed through the GI, the same as the lead, and also by the lungs. And skin absorption is very low. And then uh, uh, arsenic binds to the sulfhydryl groups in the tissues, mostly in the hair, nails, and skin. And removal is by the urine. Uh, uh, and toxic effects are because of the enzyme function interaction, and also by the oxidation of the tissues. And um, most of the time uh, the intoxication occurs through this drinking water, and that leads to the dermatologic lesions, and this is a chronic disease. And treatment is uh, uh, is with the supportive care and halation with Unitio. It can be given intravenously and also dimercaprol intramuscularly, and uh, uh, and the earlier the treatment is started, then the more is the effective the treatment. Then the next one is mercury, and mercury is also known as quicksilver, is a liquid metal, and uh, is used in the thermometers for the measurement of the temperature, but in recent years have been replaced by the electronic thermometers. But still, in some developing countries, the mercury is still used as in the measurement thermometers. And industrial mercury is also very common, and uh, the birth defects are also known because of the consumption of the mercury containing fish. And Uh, Mostly mercury is mined as mercury arsenic, uh, and then converted to other commercially available forms. And the usually the common use of the mercury is the electrical equipment and fluorescent lamps, and also dental amalgam, but has been replaced with other compounds in stomatology. So currently is not used in stomatology at all. It also used in the gold production and also is as a biocides and as antiseptics sometimes. The uh, Sometimes is used in vaccines in form of the ethyl mercury. And mostly exposure to the mercury is mostly from the burning of fossil fuels or because of the bioaccumulation in fish uh, in those uh, in those communities where the fish is popular. Uh, then absorption of the mercury is uh, depends on the type of the chemistry. The elemental mercury is very volatile and absorbed from the lungs. Of GI absorption is lower and usually absorbed by the lungs. And percutaneous absorption uh, can be seen with the inorganic mercury, especially with the chronic exposure. And alkyl mercury is fast absorbed through the skin and can lead to the acute uh, intoxication. Uh, Mercury is well distributed through the tissues in several hours after absorption. Then and the highest concentration is in the kidney. Excretion is through the urine. Uh, uh, the mercury is usually can be kept in the body for the long time and also bind to the keratinized tissue like nails, hair, and uh, it can be connected with the can be uh, same as the lead and arsenic. So lead, arsenic, and mercury are uh, accumulated in keratinized tissues, nails, and hair. So that is why female part of the group be aware of that because nails and hair are mostly important for the women. Fortunately, most of the intoxication is in industry where mostly men are working, so that is why uh, is less important for the men. And the treatment is with the supportive care and chelation with unithiol and dimercaprol and oral oxosimer can also be used to decrease the absorption if given during several minutes after uh, after exposure. The elimination is by urine, that is why water can increase the elimination, and the uh, uh, the the faster the chelation is given, the better is the treatment. Then and chelating agents are one of the commonly used drugs that decrease the toxic intoxication with the heavy metals, um, and also help to eliminate the metal from the body by forming a complex with the heavy metal, and that decreases the intoxication and helps to uh, to eliminate uh, the toxin. And usually chelating agents have several coordinating atoms, like here for example we have oxygen and nitrogen, uh, and it can be also sulfur, like no, we don't have sulfur here. So and uh, these atoms will donate a pair of electrons to a cationic metal. So here we can see the uh, lead, uh, and this leads to the formation of covalent bonds. Uh, the, uh, these bonds can be mono, bi, or polyendentate, and for example, here we can see the lead edited halide, that lead where lead is incorporated into 5 heterocyclic rings, and uh, this is uh, hexadentate halide. Uh, then in some cases metal binding effect can be uh, uh, not only increase the elimination but also redistribute the metal to the different tissues, uh, for example like with the dimercaprol that binds to the mercury and arsenic, and will redistribute it to the brain, and also some chelating agents increase excretion of essential cations, like for example calcium. So here we can see the calcium disodium acetate, uh, and here calcium is connected with the coordinated covalent bonds with the nitrogen and oxygen, and Uh, Also, the zinc can be connected to the EDTA the same way, uh, and copper also. So this is not clinically significant because only some body has much supply of the calcium from the bones, but prolonged chelation of these uh, ions can lead to the uh, deficiency, especially in childhood. That is why the dietary supplements with the calcium may be required to reduce the uh, deficiency. Uh, the use of chelating agents after the acute exposure uh, may be so should be used as soon as possible, and uh, and if we look at the most important chelating agents, so first one is dimercaprol or 2,3-dimercaptopropanol or BAL. Uh, so we can see uh, three atoms of the carbon. So this is propane, and it has one hydroxy group. So this is a spiritus. So that's what propanol. And at the position 2 and 3 we have sulfur hydrogen groups, and that is what dimercaptopropanol. Uh, and dimercaprol or dimercaptopropanol propanol is a oily liquid with no odor, and uh, it was developed in Great Britain during the World War II as an antidote for arsenic poisoning, when arsenic has been used as a warfare agent, Levezid. And in Great Britain, it is well known as British anti-Levezid, so that is why it's BAL. So B stands for the British. And it's usually used as a 10% solution in pear nut oil and must be administered by intramuscular injection. That is very painful. And dimercaprol prevents the inhibition of sulfide hydrogen groups by arsenic, and given early may protect against the lethal effects of organic and inorganic arsenic. And also it increases the arsenic excretion and lead excretion, and that is why it's beneficial when, and also other metals excretion, mercury as well. So that is why it can be administered with the heavy metal intoxication. Sorry. Uh, and it is can be dimercaprol can be indicated prescribed for the treatment of acute poisoning by arsenic and mercury and lead. Uh, in the latter case can be combined with the EDTA. Uh, uh, the adverse effects include hypertension, tachycardia, nausea, vomiting, salivation, and also pain at the site of injection, uh, and also thrombocytopenia can be seen, uh, and also uh, uh, the water-soluble analogs of dimercaprol, succinate, that is the MCA, and penicillamine are replacing them as the antidotes. Uh, so actually, DMCA, I worked with the DMCA in the lab, so it also is used as a solvent uh, for the substances that cannot be uh, dissolved in the water. Uh, then, so uh, uh, Succinate is an analog of dimercaprol that is water soluble, so there is no need in the pen at all, and uh, that prevents the inhibition of the sulfur hydrogen groups, yeah, and enzymes that contain the sulfur hydrogen groups, and can be used for the treatment of the acute lethal effects of arsenic. And it increases the urinary lead excretion and concentration of lead in the blood. Same for the mercury, and can be administered orally or intravenously, and uh, uh, the indication for the succinate include the treatment of children, and uh, usually it's given in the dose of 10 milligram per kilogram 3 times a day, uh, and is as effective as EDTA, uh, and the uh, the next antidote, edited calcium disodium. Uh, so this is actually the MCA coordinated molecular. Next antidote is edited calcium disodium, or ethylene diamine tetraacetic acid, or EDTA, is uh, can bind the divalent and trivalent metals to prevent the uh, to, to prevent the calcium depletion. This EDTA should be administered only orally as calcium disodium salt. And ADTA is very polar and usually administered by intravenous infusion, and can bind the lead and other 2 and 3 valent metals, and can be used with the intoxication of the lead and zinc, and also the radioactive metals. And the can be also used for the treatment of the contamination with the radioactive metals, including plutonium and other radioactive metals, or urine, radioactive urine that is used for the in the atomic energy stations. So that is a product of the bypass of the at the nuclear reactions. So the next drug is the antidote is Untitled. Untitled is a dimercaptopropansulfonic acid, or DMPS, dimercaptopropan sulfonic acid, that is why DMPS is a chelating agent that is water soluble. It is the analog of dimercaprol. So dimercaprol, so this one. And formula, actually we also have 3 carbon atoms, also 2 sulfhydryl groups, but instead of the hydroxyl groups we have a sulfonic acid, and it has been available in our country, and for a long time, and can be administered orally and intravenously, has a high bioavailability, and can be protective against the mercury and arsenic, and also lead. So the adverse effects are very low. Some dermatologic reactions can be seen as in the form of urticaria, and the Steven-Johnson syndrome may be seen with the erythema, but no other adverse effects are reported. Administration should be slow, over the half an hour, and to prevent the vasodilation and hypertension. So the next one is penicillamine, or dimethylcysteine. So we have a cysteine amino acid with 2 methyl groups, and penicillamine is a water-soluble derivative of penicillin, and D-penicillamine isomer is less toxic than L-isomere and is usually preferred, and is available orally and used for the treatment of the poisoning with copper. So adverse effects include the rash, fever, and nephrotoxicity can be seen. And N-acetylpenicillamine has been used for the mercury poisoning as well, but it's not available at the moment. The next one is deferoxamine. Deferoxamine is a drug that isolated from the Streptomyces bacteria, and it's used for the binding of the iron, and it administered intravenously, and so the next one is Deferazerox. Deferazerox is a chelator with also used for the iron and also for the other two valent cations like zinc and copper. Or can be administered orally and usually used for the treatment of iron intoxication seen after the blood transfusion, and it's very well tolerated without adverse effects. And the last one is Prussian Blue or Paris Blue, that is ferric hexacyanoferrate. Is a crystalline compound with the coordinated iron atoms connected with the cyanide groups, and it has been used for many years as a commercial pigment for the dyes, and its usefulness as a chelator was recognized recently, and it can be administered orally, and can bind the cesium and thallium and prevents the absorption from the GI, and so the radioactive metals will have shorter half-life when given with the Prussian Blue. There are almost no adverse effects, maybe little constipation, and usually used for the treatment of the cesium, radioactive cesium, and thallium source exposure. So and that is all the antidotes. So thank you for your attention, and if you have any questions or comments, then feel free to ask them below.